There are a set of basic CPR skills used to provide the most effective approach to cardiac arrest. External compression of the chest increases pressure inside the chest and directly compresses the heart, forcing blood to move from the chest to the lungs, brain, and the rest of the body. To perform effective compressions, the affected person needs to be positioned on his or her back on a flat, firm surface. Kneel close to the side of the person. Place the heel of one hand on the center of the chest, on the lower half of the breastbone. Place the heel of your other hand on top of and parallel to the first. You can interlace your fingers to help keep them off the chest. Bring your body up and over the chest so your shoulders are directly above your hands. Straighten your arms and lock your elbows. Bending at the waist, use your upper body weight to push straight down to a depth of at least 2 inches. Lift your hands and allow the chest to fully return to its normal position. Move immediately into the downstroke of the next compression. Continue compressions at a rate between 100 and 120 times per minute. Quality matters. The better you compress, the greater the influence on survival. Focus on high-quality techniques. Compress deeply, more than 2 inches. It is likely you will not compress deep enough. While injury could occur from deeper compressions, do not let the fear of this affect compression depth. Allow the chest wall to fully recoil or rebound between compressions. Avoid leaning at the top of each compression. Compress fast, between 100 and 120 times a minute. Do not let a higher compression speed result in shallower compression depth. When compressing properly, you may hear and feel changes in the chest wall. This is normal. Forceful external chest compressions may cause chest injury, but are critical if the person is to survive. The compression technique for children is similar to that of adults. To perform chest compressions on a child, position the child face up on a flat, firm surface. Place the heel of one hand on the lower half of the breastbone, just above the point where the ribs meet. Using upper body weight, compress at least 1/3 the full depth of the chest, or about 2 inches. Lift your hand and allow the chest to fully return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate between 100 and 120 times per minute. Avoid leaning. Without losing contact, allow the chest to fully rebound at the top of each compression. Compressions can be tiring. If you need to, use 2 hands to perform compressions on a child. To perform chest compressions on an infant, position the infant face up on a flat, firm surface. Place 2 fingertips on the breastbone just below the nipple line. Compress at least 1/3 the full depth of the infant's chest, or about 1.5 inches. Lift your fingers and allow the chest to fully return to its normal position. Without pausing, continue into the downstroke of the next compression. Continue compressing at a rate between 100 and 120 times per minute. Allow the chest to fully rebound at the top of each compression.